Are you considering having an aesthetic procedure performed? Confused by all the information out there? Welcome to It's a Young Thing, where Nurse Paula Young arms you with the knowledge on all things cosmetic and aesthetic. And now, Nurse Paula Young.
Hey everyone, this is Nurse Paula. Thanks so much for joining us again this week on It's a Young Thing. And today we're going to be kind of going back a little bit on previous podcasts that we talked about called Tell Me About Selfie Surgeries. And one of the biggest things that people do to make themselves look better on Facebook, and in fact, we're recording a video today actually, and this video is going to end up on Facebook. And one of the things that people want to change because they're doing your face is your nose. And not a lot of people, Steve, actually my producers here were, kind of talking about this whole nose job thing. Not a lot of people have the finances for a nose job. They don't have the downtime for a nose job. But I'm going to tell you a very quick and easy way to kind of get a mild mini, 10-minute nose job per se. And believe it or not, we kind of use dermal filler products. And one of the things, did you ever see anybody caught a football with their face? Instead, that was me when I was 10.
Am I on this? Do you want me to chime in?
Yeah, sure.
Do you want me on this episode?
My brother threw a football at me. I don't know, I must have been 10 or 11 years old. And the thing went right through my hands and smacked me right in the face and broke my nose. Oh, it was pretty bad. So I had this S-shaped bridge to my nose. It was in a kind of a little bit of hump. And nowadays you can hide that and mimic that with dermal filler products. Just the bridge of the nose we call the septum of the nose. That's actually on the inside. On the outside we have just this bridge that kind of comes down, that kind of gets crooked as we age, and even the hook of your nose starts to hook as you age. So really on the bridge of the nose, you can inject a hyaluronic acid dermal filler product, right on the, from the bridge between your eyes down to the tip. And you can fake out a straight nose using dermal fillers. It's the coolest thing. Wow. And, aging does that to our nose. People don't realize that as we age. We already talked about how it affects the hands and, hand rejuvenation podcast. And we talked about earlobes, how your earlobes kind of stretch out as you age, but your nose can do the same thing. And one of the other things that doctors can do is after you inject a hyaluronic acid fillers, something we've talked about Juvederm and Restylane and Perlane, all the Bellaterra, a lot of these dermal filler products, they'll last for a good year, maybe even 2 years to just kind of fake out a straight nose. And another thing that happens to us as we age is our nose kind of gets wider and flatter out on the nostril area.
You're really depressing me.
Look in the mirror at your nose.
any more things that happen
all this stuff happened. This is why there's aesthetic medicine, and people don't realize, there's stuff that you can do to fix it that don't involve surgery.
Hi, it's Nurse Paula with good news for today.
Let me tell you how your
Paula.
It's how your nose makes you look older. So one of the weirdest things with your nose when we get older is you kind of get that droopy hook in the end. And that's actually correctable too, with just a little injection of Botox underneath the tip of the nose can relax the muscles, and it can actually cause a little lift to the tip of your hooked nose. So
why are you looking at me when you say your hooked nose?
Every time it's funny because every time I come in here with a topic, it's you're mesmerized. It's like a deer in headlights. You're completely surprised about some of the things that we do in aesthetic medicine.
I never knew there was so much to it, and I'm so educated. I feel fortunate.
I know, it's crazy. So I have to bring my notes with me because. And a couple things I really want to tell people is that, it is much cheaper than rhinoplasty and, in a nose job. It's quicker. There's really no downtime. You have the injections. You might have a little bit of bruising at the injection site, but it's so superficial that really you don't have a whole lot of bruising to your face. It's just kind of a little bit where the injection marks are. So you really could go somewhere that night or the next day. The only thing we tell people to do is not blow your nose real hard or massage your nose. You have to give the dermal fillers time to take effect and kind of stay where they're at. So that is really all I have to tell you about like this 10-minute nose job or
come on, I'm sure you could give us more bad news.
That's it.
Nothing else negative.
Next podcast I'll probably talk about something else that fails us as we age, because these are the things that walking through the office and somebody's in and they're getting something done. I'm going, oh, what are they having done? It's like, oh, no, they're straightening out their nose with thermal fillers. I'm going, that would make a great podcast, because not a lot of people know that you can do that with thermal fillers and, bring out the bridge of your nose, lift up the tip of your nose, a little Botox. I mean, it really can give you a nice kind of like mild nose job-ish kind of correction.
Without the full thing.
Without the full thing. So if you're a selfie junkie and you want to fix your nose and you really don't want to get a nose job or you can't get a nose job, just think about possibly doing this 10-minute nose job. You're literally in and out of the office in 10-15 minutes tops, and it really can give you a nice straighter looking bridge to your nose, maybe bring up the tip a little bit and bring up a little bit of the volume on the sides of the nostrils that have kind of flattened as we have aged. So that's all I have this week, Steve, on how to fix your nose with dermal fillers. And I'm sure that we'll have something very interesting to talk about next week as well. Thanks, everyone, so much for joining me this week. We recorded a video. Make sure you go to our Facebook page. It's a Young Thing does have an actual Facebook page, so you can see this video, and all of our podcasts are on there. And you can listen to us on iHeartRadio. We're on SoundCloud, we're on iTunes, and we're also on our website at youngmedicalspa.com. We have a complete podcast page there. You can see all of our podcasts. Say goodbye, Steve.
Goodbye, Steve.
We'll talk to you guys next time.
Isn't she the best?
You've been listening to It's a Young Thing with Nurse Paula Young. If we didn't discuss a topic you're interested in today, be sure to subscribe to our podcast on iTunes, so when we do, you don't miss it. The cosmetic aesthetic world can be confusing. We're here to arm you with quality, truthful information from our many years of experience. For even more info, youngmedicalspa.com.
This has been a Steve Mittman social media creation. Steve Mittman, socialmedia.com.
The creators, producers, participants, and distributors of this podcast disclaim any liability in connection with the material expressed herein. This information should not be substituted for individual medical counseling. Information on this podcast is not intended to diagnose or prescribe treatment for any condition. It is intended for educational purposes only, based on the research and experience of Young Medical Spa. Discussion of specific treatments is done only in an office visit directly with the patient. Contact our office to schedule.